Getting back to this. To her. To family. To friends. To hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
We appreciate it.
I'm so thankful for all of your help.
Thank you so much for what you do. You're amazing and never give up.
Thank you for all of the hard work that you put in every single day. Thank you. We love you.
Thank you to everybody helping people in need.
Thank you.
I think one of the greatest consequences of mental health challenges among people of color primarily is that we wait so long to acknowledge. The resilience is almost a double-edged sword because you don't notice until you're getting headaches. You don't really notice because it's just a normalized way of life. So I think first is really training your mind and learning how to be attuned to your body and to surrender, acknowledge, and name, even just for yourself, what you're experiencing, because you can't ask for help if you don't even know you need help until it's like debilitating.
We always have a choice. In a world full of things out of our control, our thoughts, our feelings are something that we always have a choice about. And so even during difficult times, times that we're not happy with, times that aren't fair, we still get a choice on how we deal with them. We can be salty and bitter and mad at the world or mad at a situation or a circumstance, or we can choose to take an obstacle, turn it into an opportunity, and handle it as best we can.
I follow Nancy that that saying that when we used to take airplanes all the time, if you're next to someone who needs assistance, put your mask on first. And that can be really hard to do for anyone, male or female, but women have a particular hard time doing that. But I've realized in the last 15 years of my career that if I don't take care of myself, I literally can't be there for the people who depend on me. I am incredibly committed to what I call the trifecta of good health, both physical and mental health, which is good rest, good nutrition, and good fitness or exercise. And if I don't get those things on a daily basis, I start to feel the effects pretty quickly.
This fall, there's a new way to walk. Together, we are fighting for the health and well-being of our community. So this year, we will be showing up across our entire community with more places to walk to reach everyone, everywhere. Pop-up start lines will be popping up across your market, in your town, at your companies, and in your neighborhoods. That means heart walkers can heart walk here, here, or here at pop-up start lines throughout your community. We'll get hearts pumping and feet moving as we listen to the exclusive Heart Walk On Demand playlist. Your heart walk can pop up in parks, pathways, or tucked away trails from uptown, downtown, and rural roads. Let's empower our communities to take charge of their health and well-being while saving lives. Let's show the world how we rock the roads and tackle the trails. On your heart, get set, go!
This very moment we were made for. Our hearts lifted because we gave more. Fierce with purpose, never acting without a cause. Our simple desire is to offer our all. The difference made, the love we gained. A common unity is shared on this day. We answered the call and never wavered. We shared more. This moment we were made for. Our strengths revealed, achievements attained. Through sacrifices made, we lived through the change. We've owned it and persevered, offering our heart to the world, to every woman, man, boy, and girl. We rose to the occasion, no matter the situation. Shall we never forget? We were made for this moment.
Good evening and welcome to the American Heart Association's 2021 National Volunteer Awards. Tonight, we're going to recognize 20 of the AHA's most prestigious volunteers and one outstanding staff member. My name's Sonia Azad. I'm the health and wellness reporter at WFAA. I'm also an AHA volunteer as one of the hosts of House Calls, Real Docs, Real Talk. So I'm really excited to be here with you tonight. We're going to have so much fun. So let's get ready to engage and enjoy. So for the next hour and a half or so, we really do want to hear from you. That's what's going to make it fun, right? We are broadcasting live from YouTube. So do make sure that you're signed into YouTube so that you can comment and congratulate our awardees in the chat box all throughout the show. So we want to hear from you right now. Let's just go ahead and get this party started. Type in the chat box where you're tuning in from. I always love to see where people are watching from. For instance, I'm broadcasting from the AHA's National Center in Dallas, Texas. Of course, I've already seen a lot of you folks watching also from Dallas. I've seen a little bit of Ohio in here, maybe an Iowa or two. Also, if you're on social media, be sure to recognize our awardees and use that hashtag #AwardsWithHeart. We're happy to see your selfies. If you got a watch party going on, we want to see that as well. So we appreciate you being here. Wow, Kim joining from Pennsylvania. I love to see that. We got Bentonville, Arkansas in the house. Okay, hello to our friends in Arkansas as well. A lot more folks from Dallas, Texas. Oh my goodness, Colorado, Kansas City, New Jersey, California. Hello, Santa Monica. Okay, San Jose. Lots of Minneapolis. You guys are really enjoying telling me where you're from. I like this. I feel like this is a really excited crowd. Okay, keep letting us know where you're from. Hey, you might see some friends where you're at, same city, or maybe a city you really want to live in. All right. Thank you to all of you for being here tonight. So let's go ahead and get this party started. I want to extend a warm welcome to Bert Scott, the American Heart Association's Chairman of the Board, Dr. Mitch Elkin, President, and Nancy Braun, Chief Executive Officer.
And Sonia, I want to thank you for that very warm welcome this evening. As Sonia mentioned, I'm Bert Scott, Chair of the National Board of the American Heart Association. And we have an unforgettable evening ahead of us as we honor AHA's brightest stars. I couldn't be happier to share this virtual stage with two of my favorite people, Mitch Elkin and Nancy Braun, whose exceptional leadership this past year has demonstrated that the AHA truly is made for this moment.
Thank you, Bert. It's been quite a ride, and there are no two people that I would choose to work with through a pandemic other than Bert and Nancy. Now, some of you may have heard the story that 20 years ago, Bert funded my first fellowship, launching my research career and connecting me to the AHA. Now we've come full circle to co-lead this life-saving organization, at least for 7 more days.
Bert and Mitch, you have each contributed unmatched expertise, energy, and compassionate impact for the people who are counting on us most. We will miss you dearly, but we know you won't be far away, and we have your numbers. On July 1st, you'll each pass the proverbial torch to the capable hands of Ray Vera, who becomes chairman of the board, and to Dr. Don Lloyd-Jones, who will become AHA president. Ray and Don will join us live a little bit later in the program, and we really look forward to hearing what they have to say. Just so you know, this National Awards event is a time-tested tradition for more than 7 decades. As a matter of fact, our first event was held in 1950. This past year is especially important as we recognize 21 remarkable people who not only rose to the occasion in support of AHA's mission, but many of their activities supported us during the global pandemic. There is no question these volunteer leaders and staff leaders were made for this moment.
All right, we've got a lot of people to get to, as you just heard. So are you all ready? Because I'm ready. The Gold Heart Award is the American Heart Association's highest volunteer honor. To say a few words about our first Gold Heart Award recipient, Dr. Lynn Braun, let's welcome Dr. Donald Lloyd-Jones, incoming president of the AHA.
Hi, I'm Don Lloyd-Jones, President-elect of the American Heart Association. It is a joy to extol my dear friend Dr. Lynn Braun as a recipient of AHA's Gold Heart Award. In thinking about how to encapsulate all of Lynn's incredible leadership throughout her career, it occurred to me that maybe all I need to do is just read her name. Lynn Braun, PhD, CNP, FAHA, FPCNA, FNLA, FAANP, and FAAN. That's right, Lynn is a fellow of 5 professional societies dedicated to making patients' lives better. That, for me, is maybe the clearest indicator of Lynn's amazing dedication to her profession and to her personal mission to improve patients' lives and the care that we provide them. And it's also an indicator of just how indispensable Lynn has been for the AHA. For those of you who don't know her, Lynn is a nurse practitioner and a clinical lipid specialist and a professor here at Rush University Medical School in Chicago. For decades, she's been the go-to person for the clinicians and the patients' perspectives on prevention and the implementation of evidence-based care. As far as I can tell, she is the most sought-after speaker on the application of cardiovascular prevention strategies in clinical practice. Lynn has a remarkable ability to cut to the chase, to generate science, and then to synthesize and frame the important issues, and come up with how to translate all of that to patients in a meaningful way. Lynn has led the fight on multiple fronts, from lobbying for public health, to improving systems of care, to teaching, and to community service. Over her decades of service to the AHA, Lynn has filled countless leadership roles for our organization, including, just to name a few, Chair of the Advocacy Coordinating Committee at the national and state levels, Chair of the CVSN Council, and as a member of numerous committees at every single level of AHA. She recently completed her term as Midwest Region Board President and is a former president of the Chicago Metro Board as well. Her fingerprints are all over more than 15 AHA scientific statements, guidelines, and policy statements. Happily, this is not the first time we've had the opportunity to honor Lynn, as she is a prior recipient of the Healthcare Volunteer of the Year Award and the Corps d'Or at the Chicago Heart Ball. Lynn, in this year, when our nursing colleagues and friends have demonstrated yet again that they are the true front lines in patient care, it is particularly fitting that we honor you for your tireless advocacy, your deep wisdom, and your unwavering dedication to AHA's mission. You truly are a relentless force for a world of longer, healthier lives, and I am so proud to call you my friend. Thank you for all of your amazing contributions to the AHA, and congratulations on winning the Gold Heart Award.
Don, thank you so much for those very, very kind words. An award is all the more meaningful when a dear friend of yours who you admire so greatly presents it to you. So thank you so much. I am so grateful for this award. This is it. I don't know if you can see this. It's very beautiful and very heavy. So I'm going to set it down. I am particularly grateful to the Council on Cardiovascular and Stroke Nursing, who nominated me for this award, and certainly to the board for awarding it to me. I feel so fortunate to have sought out volunteer opportunities with the AHA as a young nurse and faculty member back in 1980. The mission of the American Heart Association truly resonated with me as I took care of some of the sickest patients with heart disease, and I just knew it could be prevented. My work with the AHA has had a tremendous impact on all aspects of my career, certainly my clinical practice, but also what I teach and research. Many of my friends and most of my colleagues I have met through the AHA, including the very talented and passionate AHA staff. As a volunteer, I've had an AHA career that has really run parallel with my nursing and academic career. I'm grateful for all of it and for the opportunities at the local, regional, and national levels. My hope is that all individuals whose first touch point with the AHA is through grant funding or perhaps an abstract presentation at scientific sessions are given the opportunity to volunteer at the local level and to see the true impact the AHA has within communities. I'd like to give my sincere thanks to the AHA staff and the volunteers with whom I've worked over so many years, like you, Don. You are all relentless in your quest for a world of longer, healthier lives, and you inspire me. You truly inspire me every single day. Finally, I am most grateful to my family, my husband, Tom, my children, their spouses, and my dear grandchildren who've supported me every step of the way. I will continue to do the important work of the American Heart Association because I want my young grandchildren to retain their perfect cardiovascular health. Thank you all so much.
Oh, that was beautiful. Thank you. Our second Gold Heart Award goes to Dr. Mark Fisher, presented by Dr. Ralph Sacco, Editor-in-Chief of Stroke and former President of the American Heart Association. Dr. Sacco, welcome.
It is my great privilege to introduce our next Gold Heart Award recipient, Dr. Mark Fisher, a dedicated AHA volunteer who served as editor-in-chief of the AHA-ASA journal, Stroke, for 10 years. Good evening. My name is Ralph Sacco, and it is really a special privilege for me to be able to introduce and give this award to my friend, colleague, and fellow neurologist, Mark Fisher. I've known him for 30 years when I think we first met around the pool at one of the stroke meetings, and he asked me to help write a chapter for one of his many books. Last year, I assumed the role as Stroke's editor-in-chief, and I can tell you firsthand, when Mark passed the baton of the world's premier stroke journal, I really had some huge shoes to fill. Mark led the journal for 10 years and into the 50th anniversary. He was instrumental in starting many new initiatives to keep the journal as the leader in the field. He was one of the first AHA journal editors to develop a trainee reviewer program, recruiting from US-based and international stroke fellowship programs. Additionally, he started the International Stroke Early Career and Training section, Intersect. These early career programs are critical investments in the next generation and have since been implemented across all AHA journals. In his tenure at the journal Stroke, Mark also started the Focused Updates, which are a collection of topical reviews on relevant hot topics in the field. He also initiated the preclinical checklist to verify key elements that strengthen basic science data. He helped keep the journal Stroke innovative and indispensable to anyone in the field of stroke. For 36 years at the University of Massachusetts Medical School, Mark pioneered MRI technology to evaluate ischemic brain injury. He led seminal clinical stroke trials and trained countless research fellows, residents, and international scientists. Many of his trainees are current major contributors to stroke. He started the STARE conferences, Stroke Academic Industry Roundtables. These conferences have brought multiple constituents together to chart the course for the future breakthroughs in stroke treatment. With a reputation for scientific rigor and clinical excellence, Mark still sees patients and educates stroke physicians at Beth Israel Deaconess Medical Center. In November 2020, he assumed the role as president of the World Stroke Organization, where he continues to advance stroke science and clinical care throughout the world. I can think of no one more deserving of this Gold Heart Award. Please join me in congratulating Dr. Mark Fisher.
I was surprised to see Ralph doing the introduction. So thank you very much, Ralph, for the kind words and overview. I would like to thank the AHA for bestowing this prestigious award on me. I have had the opportunity of working with the AHA and its affiliated organization, the American Stroke Association, for many years. The AHA and the ASA have been instrumental in moving the field of stroke forward. As many of you know, this has been an incredible time in the stroke field over the past 5 to 10 years. We have seen great advances in developing stroke treatments, stroke diagnostics, and stroke prevention. As Ralph mentioned, I had the honor and distinct pleasure of serving as the editor-in-chief of Stroke from 2010 to 2020 during this golden era of stroke advancements. The AHA must certainly be acknowledged for leading the charge as it, along with the ASA, has organized the International Stroke Conference for over 50 years, and also has Stroke, the leading journal in the field, to help educate practitioners and the public at large about the advances in stroke. I would like to thank my family, especially my wife, Debbie, who's here in the room with me, for her support during my academic career. I could not have done it without her. And I would also like to thank my 2 sons and their children as well. In conclusion, I would say that as president of the World Stroke Organization, we are working very closely with the AHA and ASA to move the field of stroke forward around the world. Thank you again for bestowing this honor upon me.
Next, Susan Croushore and Martha Stark will receive the Morgan Stark Memorial Award, presented by Dr. Paul Mather and Nick Racanelli.
Hello, I'm Paul Mather, and I have the great honor of recognizing Susan Croushore as she receives the Morgan Stark Memorial Award tonight. Together, Susan and her co-recipient Martha Stark have been American Heart Association volunteers for a combined 50 years, serving as board members who have shaped how the AHA engages volunteers and creates healthier communities. Susan and I have both had the privilege of serving on the board of the former Great Rivers affiliate, Susan as chair and I subsequently as president. This award recognizes Susan's remarkable ability to empower volunteers, strengthen bond between volunteers and staff, and encourage diversity. Susan and Martha co-chaired the AHA's National Volunteer Oversight Group and led the Gold Standard Board Program, establishing best practices for boards of directors across the country. A retired healthcare executive, Susan currently leads the Philadelphia Division Board and the Eastern States Nominating Committee, among her many, many contributions. During these difficult times, our country needs no thin idealist, no harsh realist, but a person whose eye reads the universe while their feet are firmly on the ground. We need a person of universal sympathies but self-possession, a person to whom this world is no mere spectacle or fleeting shadow, but a great and solemn arena to be played with good heed. A real leader is somebody who can help us overcome the limitations of our own individual selfishness, weakness, and fear, and to get us to do better things than we can achieve on our own. To me, Susan embodies this definition of a great leader. There is no question she has left an indelible mark on the American Heart Association that will be felt for years to come. So please join me in congratulating Susan.
When Nancy Brown called me to introduce Martha Stark to the prestigious Morgan Stark Award, I jumped at the opportunity. By way of background, I've known Martha for over 20 years, serving on various boards, committees, and task forces with her. And equally important, I knew Morgan Stark, who was a wonderful human being and a real advocate for the mission of the American Heart Association. Some of Martha's national accomplishments are as follows. Martha joined the National Volunteer Oversight Group in 2012, serving as chair and co-chair with Susan Croushore. You see, Martha always believed that the success of the organization was building long-term relationships with our volunteers within our grassroots communities and nurturing strong staff partnerships. Martha also led the Gold Standard Board Program and helped launch community planning strategies that have evolved into today's community impact strategies and community assessment processes. Words I would use to describe Martha are passionate, tenacious, kind, brilliant, philanthropic, sympathetic, mission-oriented, dedicated, goal-oriented, focused, team player, a leader, and most of all, fun to be around. The quote from Martha is telling to who she is as a dedicated volunteer. What always impressed me volunteering for the American Heart Association were the relationships. I made friends for life. I always benefited more personally and professionally from the AHA than I was able to give back. And it's those qualities that Martha had the ability to empower volunteers, strengthen bonds between volunteers and staff, and encourage diversity. As past chair of Long Island, New York, and the Founders Affiliate, Martha believed that although the bulk of our revenue generation will come from our major metro areas, the success of our organization needed to be battled within the grassroots communities across the nation. She always fought hard to engage regional and divisional boards, and that was a real strength of hers. On a personal note, I am proud to know Martha and be able to call her a dear friend. We both have done wonderful work together for the American Heart Association over the years and had a blast doing it. The AHA brought us together for life, and it's the memories created that will have an everlasting impact on both of our lives. Congratulations, Martha. You are so deserving of this wonderful honor.
Well, thank you, Paul, very much for that lovely introduction. I am very grateful for those kind words, and you're someone that I admire greatly as living the mission of the American Heart Association. You know, I've worked for decades in healthcare and participated in countless community volunteer efforts. But by far, the most joy and personal satisfaction that I have felt is with my work with the American Heart Association. And that's why this award is so meaningful to me, especially now that my career has sunsetted. You know, I will always be grateful to Dr. Creighton Wright, who was a cardiovascular physician, wonderful, talented surgeon in Cincinnati. He came into my office one day and asked me to get involved with the local Cincinnati Heart Board. And I did, and it was a joy. But I have to say, it wasn't until I began to work with Nicole Aiello-Sapio that I truly bonded with the AHA. And I have told Nicole, she's our Eastern States Region Executive now, and I've told her, you know, literally I would do anything that she asked me to do. And it's because she lives the mission of the AHA, and she's just so inspiring to me. So Nancy Braun, you lead a stellar organization that really attracts and retains top talent. And while I know that the AHA relies heavily on the volunteer base, as well as treasures the volunteers, I've found that it's really the staff that's the secret sauce. The staff is what makes the volunteer work happen. And all of the good work and outcomes would not have happened without just superb staff that you have. I do want to give a shout out to my fellow awardee, Martha Stark, you know, because she really solely deserves this honor. All I did was follow in her footsteps and try and emulate her good work. So my thanks to the AHA for allowing me to be a small part of this work. Thank you.
Hello. Is this live?
Okay. Martha, you are on. We'd love to hear from you.
I'm on. Wait a minute, this is live? Where's my script? American Heart Association always has a script. Wait, okay, wait, that's all right, that's all right. One minute, I can do this, really. Much better. Okay, thank you. All right, thank you for this award and for this beautiful clock. It means a great deal to me, especially coming from you, Nick. I can't thank you enough. I also want to recognize and congratulate Susan and tonight's other awardees. I had the good fortune of working alongside Morgan Stark on the affiliate board. Morgan had an unbelievable passion for the work of the American Heart Association and the American Stroke Associations. Receiving the award in his name is an honor of a lifetime. I want to take a brief minute to thank just a few of the many people who helped me over the nearly 30 years of my work with the AHA. My own cardiologist and longtime friend, Dr. Stacy Rosen, Dr. Cheryl Pegas. She was the president of the affiliate board when I was chairperson. My close confidant, an extraordinary volunteer in his own right, Nick Racanelli. Other volunteers who made my journey such a memorable one: Gil Bash, Bernie Dennis, Cindy McLaughlin, Dr. Johnny Lee, Dr. George Philippides, and Dr. Jerry Marks. I also want to remember and thank a few of my AHA staff partners who shared in my successes and made our achievements possible. Kathy Munch, Stephen Malidi, Mike Weimer, Bill Thompson, and Michelle Gravatt. The last and most important person to thank, my husband, Bob Stark. Not only has he supported me for all my work with the American Heart Association, but because of him, I'm able to live my best life. Thank you all.
Oh my goodness. Well, congratulations to Lynn, Mark, Susan, and especially Martha. Martha, this is still live, by the way. You should have seen everyone in front of me, their jaws dropped to the ground when you asked, is this live? And yeah, by the way, our friends on YouTube, this is live. I hope you enjoyed that, Martha. I know everyone here is breathing a sigh of relief, but truly thank you all for your contributions. And you know what, everyone on YouTube, you are echoing these sentiments as well. Christopher saying truly life-saving work indeed. Elizabeth saying such talented individuals. Thank you all for your comments and for acknowledging these terrific people. And keep the comments coming, by the way. We've got a whole lot more for you. And now Bert Scott is going to say a few words about our next awardee, the late John Russell Houston III, whose grandson will accept the award in his honor.
Tonight, I have the privilege of honoring the late John Houston III, the recipient of the American Heart Association's Louis B. Russell Jr. Memorial Award. John's actions matched his words. He cared deeply about equity, diversity, and helping under-resourced communities. So it was destiny when John attended a reception hosted by Mark and Brenda Moore about Mark's new book, A Stroke of Faith. During the reception, the American Heart Association was recognized for its Empowered to Serve platform to fund solutions that create health equity in communities. Inspired by the AHA's work, John donated his first gift of $500,000 to support strategies that boost local innovations to improve community health. His philanthropy also launched the historic Black Colleges and Universities Barbara W. Houston Legacy Award, named in his late wife's honor. It's funded students' innovative ideas to create equity on campuses and within their communities. Kind, loyal, generous, and determined, that is the legacy that John built and honored with his final $500,000 gift to the AHA Social Impact Fund, creating food, housing, and economic solutions in the greater Washington region that John called home. John's short yet powerful impact embodied everything that Louis B. Russell Jr. and his work stood for. Please join me in welcoming John Houston V, who is here tonight to pay tribute to his grandfather's legacy to ensure every person has the opportunity for a long, healthy life. Welcome, John.
Good evening. My name is John Houston, and I have the honor to be able. Good evening. My name is John Houston, and I have the honor to be able to accept the Louis B. Russell Jr. Memorial Award on behalf of my grandfather, John R. Houston III, who's being honored tonight posthumously. Thank you, Bert, Nancy, and the American Heart Association team for hosting this outstanding event, recognizing the work of volunteers for their selfless acts that create real positive impact in people's lives. Secondly, I thank the AHA for honoring the work my grandfather did with the association. It's comforting to have our loved one honored with a special award whose namesake, a Black man who not only lived 6 years after his heart transplant, a world record at the time, but who also was a teacher who developed young minds as a volunteer with the AHH, spreading the word about heart disease prevention in historically excluded communities. Over the course of 4 years, my grandfather built a legacy of impact with the AHA through donations totaling over $1 million, supporting work addressing the social detriments of health and structural racism, which so often gives rise to economic and health disparities. His commitment to addressing these issues and belief in pioneering minds led him to fund a new AHA program, empowering students at historically Black colleges and universities to work within the communities to create innovative answers to health barriers. His final gift of $500,000 helped to recently launch the AHA's Bernard J. Tyson Impact Fund in the Washington, D.C. metropolitan area, which supports community-led social and economic solutions to improve health. We're looking forward to seeing this unfold. Creating a legacy is about more than external recognition or awards. It's about planting seeds that you may never get to see, to create a brighter tomorrow for others to flourish. Our grandfather did this through his work with the AHA. Our family is comforted knowing that he experienced the impact of his philanthropy and that his legacy will live not just through the family and friends, but also through the lives he touched and those he will continue to impact. Thank you again for honoring the work and legacy of my grandfather, John R. Houston III. And may we continue to be a relentless force for a world of longer, healthier lives. Thank you again.
John, thank you so much. I know you must be so proud of your grandfather's legacy. Let's jump straight into our next 5 awardees who are each being recognized with the Award of Meritorious Achievement. First up is Dr. Tracy Wong, introducing Dr. James DeLamos and Sandeep Das.
Hi, I'm Tracy Wong, Professor of Medicine at Duke University. It's a tremendous honor for me to present the AHA's Award of Meritorious Achievement to my colleagues and great friends, Dr. James DeLamos and Sandeep Das. I've worked alongside these amazing individuals for more than a decade. Both are very busy clinicians at UT Southwestern. Both are editors of Circulation. And beyond their clinical and research responsibilities, both have logged countless volunteer hours to the AHA. When the pandemic hit last spring at UT Southwestern, fellows were put on leave, procedures were canceled, and many busy clinicians found themselves suddenly more idle but itching to contribute. James and Sandeep decided to act. They rallied their fellows, meeting daily to go over all the COVID cases in their hospital. They worked to detect patterns that might guide clinical care and facilitate clinicians ordering the right tests and treatment. Recognizing that their local insights needed to be confirmed with more data, their vision very quickly expanded to developing a nationwide initiative. This idea was pitched to the AHA, leveraging the existing Get With The Guidelines registry infrastructure so that we could collect comprehensive data on hospitalized COVID-19 patients everywhere. It's been amazing to be part of the rapid stand-up of this registry. From inception to its first patient occurring within a matter of weeks, it's been nothing short of extraordinary. James and Sandeep also pushed to allow multiple investigators to access the data in parallel so that knowledge can be rapidly generated as we fight this deadly disease. The Award of Meritorious Achievement recognizes their compassion to action and exemplary dedication. And so it's my distinct pleasure and privilege to present this well-deserved award to Dr. James DeLamos and Dr. Sandeep Das. Congratulations.
Thank you.
Thank you, Tracy. It's such a pleasure to receive this award from you, given all your amazing contributions to the registry. I'm really humbled and honored to receive this award, and I'm particularly delighted to share this with Sandeep Das, my long-term partner at UT Southwestern, and also to share this with Anne-Marie Navar, our new colleague and somebody we're so delighted to be able to work with. This award happens to recognize me and Sandeep, but really is the result of an amazing team effort from, as Tracy said, beginning with work from our fellows at UT Southwestern, where they really led the efforts to teach us about COVID and think about how we might, as a cardiology division, make a difference, to the insight of Nancy and Mariel Jessup, Michelle Bowles, and the AHA presidents to listen and immediately jump on board when we presented the idea of expanding this operation nationally. And really built off of the backbone of amazing individuals at the AHA. We've heard from other awardees just how special the professionals at the AHA are. I've been simply blown away by the talent, creativity, energy, and commitment. I think that the team that includes people like Christine Rattan, Heather Alger, Jason Walcock, Joe Williams, Jennifer Hall, and Laura Stevens at the Precision Medicine Platform, these individuals were instrumental, not just in guiding us along the way, but also energizing us, creating new avenues for leveraging the registry. And it's been, simply an amazing partnership, and something that I think we all shared in terms of a commitment and an opportunity for all of us in the midst of this tremendous tragedy to work together as a team and try to give something back. So really, on behalf of the entire team, I'm really grateful for this, and thanks so much for the honor.
Fantastic introduction. I got to figure out a way to hire you to introduce me more often. When we were first facing down the barrel of this pandemic about 14 months ago, I really couldn't have imagined that helping to contribute to building something like a registry that would encompass well over 100 medical centers and nearly 50,000 patients. I'm deeply humbled by this award. I want to echo James's sentiment that it's really the result of a lot of hard work by very many people. Chief among them, James, my registry steering committee co-chair, longtime mentor and longtime friend, who's absolutely been instrumental in every aspect of this registry's success. I want to thank the members of the steering committee, including Tracy Wong, who, along with the operations committee and the research and publications committee, who gave very generously of their time to make sure that this could succeed. I want to thank AHA leadership, Nancy, Mitch, and Marielle, who really took the risk of greenlighting a project that, it seemed a little crazy at the time. AHA staff, as James mentioned, Christine, Jason, Joe, Heather, Michelle, Laura, and Jen, who set up a registry from scratch in a matter of weeks, which I would not have thought possible until I saw them do it. And most importantly, I want to thank my wife, Heather, and my son, Connor. This has been a really rough year for many families. And I have to say that they didn't flinch when I voluntarily took on a bunch of extra commitments that took time away from them. And so they are absolute troopers, and I want to thank them as well. So on behalf of all of those people that contributed to making this happen, I want to say thank you.
Now, Dr. Regina Benjamin, former Surgeon General of the United States, will present the Award of Meritorious Achievement to Dr. Keith Churchwell.
Hello, I'm Dr. Regina Benjamin. I am pleased to present the Award of Meritorious Achievement to Dr. Keith Churchwell to recognize his more than 20 years of exceptional leadership, expertise, advocacy, and counsel to the American Heart Association. As a cardiologist and president of Yale New Haven Hospital in Connecticut, Keith studied both the hard data and the day-to-day experiences of how COVID affected different populations. I have the privilege to sit beside Keith on the AHA National Board of Directors to see him in action. His credibility as a trusted voice has shaped the association's approach to tackling health disparities, eliminating structural racism, and transforming communities. He was the lead author on the landmark AHA Presidential Advisory on Structural Racism as a Driver of Health Disparities. By serving in leadership roles and on several regional AHA boards, Keith has provided volunteers with strong voices and effective tools to serve their communities. Keith's servant leadership and his leadership by example continues to inspire us all, especially young African American men. I can think of no one more deserving of the Award of Meritorious Achievement, and I want to be the first to congratulate my friend and colleague, Dr. Keith Churchwell.
Thank you, Regina. You know, I joined the local board in Nashville some 20 years ago as an opportunity to fulfill a promise to myself as work in finding a pathway to do more in the profession I had chosen. AHA's mission to reduce and eliminate cardiovascular and cerebral vascular disease resonated with me and continues to be a big part of my why to this day. But to fulfill these missions, it became very evident in our discussions in these local small board meetings, the subsequent meetings with the Southeastern affiliate, the Founders affiliate, and the Eastern States affiliate, the Diversity Leadership Council, and all of the AHA forums where I've had the honor to participate. Achieving these goals would take more than what we had started with 20 years ago. The questions of equity, diversifying our workforce, determining and finding solutions to the issues of the social determinants of health have come into not only our regular discussions, but has also become a part of the intent to understand and actions to fix for this amazing organization. That we lead with science means that we always work to understand the problems and the issues that we face. This organization has worked to live up to its values and to be out in front, not just giving lip service to these issues at hand, but working to give voice to those who may have been voiceless, actively working towards concrete solutions that are completely aligned with our mission, that no person is left behind and all have the opportunity to benefit from the great science and the advocacy to improve the health of our patients, our families, everyone. Thank you for the opportunity to help in playing a role in the development of these three great affiliates. Thank you for letting me play a role in AHA's journey in understanding and working towards solutions for health equity and its impact on cardiovascular and total health. A big thank you to all of the volunteers and staff at AHA who have been an important part of my journey with this great organization. And a heartfelt thanks to my wife, Leslie, and my daughter, Lauren, for their support and understanding for the late nights and the days away from them. Theodore Parker, who was an American transcendentalist and reforming minister, said in 1860, "The arc of the moral universe bends towards justice." As an amendment to this beautiful theme, I would say our arc for true health and true opportunity for equity bends towards justice with the great work that the AHA is leading and will give us the best and brightest chance for optimal health for all. Thank you.
Our next award of meritorious achievement is Denise Bradley-Tyson, presented by AHA Chief Executive Officer Nancy Braun.
This next award is deeply personal to me. I am honored to recognize my dear friend, Denise Bradley-Tyson, with the American Heart Association's Award of Meritorious Achievement. When Denise's beloved husband, Bernard J. Tyson, died suddenly at the age of 60 of heart disease in November 2019, Denise immersed herself in work to carry on Bernard's legacy. Denise and Bernard have always shared an immense passion and a commitment to addressing the societal causes of poor health, including mental health. They worked together to promote affordable health care and equitable health for all. Denise's idea to continue Bernard's steadfast commitment after his passing spurred the establishment of the AHA's Bernard J. Tyson Impact Fund, where Denise now serves as volunteer executive chairman. She is tenacious and she is passionate, and she has inspired an incredible $11.8 million in contributions in just the first year, where we have already invested 31 investments going to social entrepreneurs and organizations solving community challenges to improve health. 7 major metro communities across the country are now benefiting from Denise's vision. At least 20 more investments are being planned before the end of the year. And currently 97% of the fund's investment portfolio is led by people of color or women as we work to break down the inequities in funding as well. Denise, it is such an honor and a privilege and so much fun to work alongside you to make this lasting impact in Bernard's name. He would be so very proud. Our journey is just beginning, my friend. Thank you and congratulations.
Thank you, Nancy, for that wonderful introduction. I'm truly honored and humbled to receive this award for meritorious achievement. But it's really a recognition of the important work that was Bernard's life mission, leveling the healthcare playing field to ensure equal access to healthcare for all. He focused on social injustice and the social determinants of health so that Black and Brown Americans in particular had equal access to quality healthcare. I believe that this world is a better place because of Bernard. But we all know it takes a village. This award is also a tribute to all of you at the American Heart Association, both staff and volunteers who supported this initiative, starting with Nancy Braun, who immediately embraced the idea of the Bernard J. Tyson Impact Fund when I called her days after Bernard's sudden, unexpected passing. Finally, me receiving this award is a tribute to all of the community of donors, large and small, who have stepped up to contribute. To you, I say, I so appreciate your belief in the mission of the AHA Bernard J. Tyson Impact Fund. Hopefully, if you've had a chance to read the Year One Fund report, you are pleased with the work your dollars have been able to do in communities around the country. Bernard was an authentic, infectious, extraordinary, visionary leader who continues to be my North Star as I think about the ways, both tried and true and innovative solutions, which we can connect strategically to build a healthier, more equitable country. Thank you again for affording me the opportunity to serve.
Next up, Dr. Anne-Marie Navar will receive the Award of Meritorious Achievement presented by her proud family.
Good evening. I'm Lynette Navar, former nursing director for a South Texas clinic for the uninsured. I'm also Dr. Anne-Marie Navar's mother. Tonight, I'm joined by my husband, John, and my daughter, Natalie, to honor Anne-Marie for her enthusiastic leadership in launching Doctors with Heart, a program reinventing specialist care for and underinsured patients. When you work in a clinic for uninsured patients, healthcare disparities are alarmingly apparent. These clinics, usually staffed by volunteer providers, lack the luxury of specialty referrals such as cardiology. Our lead physician, Dr. Richard Porter, often asks me to reach out to our cardiologist daughter, Anne-Marie, for guidance in managing patients presenting with complex cardiac problems. We all knew how lucky we were to have Anne-Marie as our specialist referral workaround. Ours was a unique solution, not available to most clinicians serving patients with socioeconomic challenges. Although many physicians are happy to informally consult with a colleague, patients truly need in-depth, comprehensive treatment plans with consistent specialist follow-up. Anne-Marie saw this unmet need as an opportunity, and Doctors with Heart was born. This new innovative platform allows the primary care clinic physician and their patients to access cardiovascular specialists and receive free expert consultations via telemedicine.
As a physician and your father, I'm so proud of your accomplishments.
And as a nurse, AHA staff member, and your sister, thank you so much for your dedication to advancing health equity. It is our honor to present you with the AHA Award of Meritorious Achievement.
Congratulations, Anne-Marie.
Well, AHA, you've made me speechless. I did not know you were going to have my family here, and I have tears in my eyes. So thank you for that. I want to thank the Heart Association, not just for this award, but for supporting this program. A huge thanks also to the Aetna Foundation, who provided the seed funding to get us off the ground. It has been my absolute privilege to work with the most amazing team at AHA. First, and most importantly, thank you to Cassie Walker, who did the hard work to turn this vision into a reality.
Thank you also to Patrick Waite, the director of AHA's Center for Health Tech and Innovation, who helped catalyze this program, and to my co-volunteer and constant sounding board, Eric Peterson, who helped me refine this crazy idea into something achievable. At the Center for Health Technology and Innovation, we worry a lot that advances in digital health may be good for some, but threaten to widen the already unacceptable disparities in healthcare due to the legacy of structural racism, the effects of poverty, and the lack of universal healthcare in the United States. Doctors with Heart, our telemedicine-based platform that delivers free cardiology consults to clinics who treat the underserved, is an example of how we can use technology to start to close this gap. Finally, I want to thank my parents, John and Lynette Navar, who you just heard from. Dad, you've been my inspiration my entire life, not just to be a doctor, but to dedicate my life's work to helping others. My mom served as the nursing director for Mission of Mercy for over a decade. Under her leadership, Mission of Mercy grew from a small mobile clinic to a large freestanding health center, providing comprehensive care to the uninsured of South Texas. Mom, your conviction that the uninsured deserve the highest quality care and your work to prove that it's possible to deliver uncompromised, comprehensive care, regardless of resources, will continue to drive me to find solutions to bring evidence-based cardiology to everyone. The doctors and volunteers at AHA are an army of love, ready to be sent into battle to fight heart disease. I can't wait to expand our program to fully tap in to this reservoir of talent and generosity as we grow our program across the. To end, I'm going to borrow from Mother Teresa, who I think said it best. None of us, including me, ever do great things, but we can all do small things with great love, and together we can do something wonderful.
Nancy Brown rejoins us to present the final award of Meritorious Achievement to Aramark, accepted by John Zillmer, CEO of Aramark.
Good evening. Tonight, I'm honored to present the Award of Meritorious Achievement to Aramark, the largest U.S.-based food service company taking nutrition to heart. Aramark approached the American Heart Association with a big 5-year goal to pair menu innovation and transformation with community health education to significantly improve the health of all Americans. The American Heart Association and Aramark share a commitment to build longer, healthier lives, and we knew that together we could make a significant impact. So in 2015, we launched the Healthy for Life initiative, empowering Americans to choose healthy food, nutrition, and active lifestyles. The results have been tremendous and demonstrate the power of the food industry to lead voluntary positive change. Aramark has achieved an incredible 20% average reduction in calories, saturated fat, and sodium, and almost 20% increase in fruits, vegetables, and whole grains across their menus served in workplaces, hospital cafes, and university dining halls. Additionally, communities around the country are turning to our Healthy for Life program to engage and educate people around healthy eating and healthy lifestyles. From reducing inequity to enhancing community health and protecting our planet, Aramark continues to break new ground, especially in under-resourced communities. As a member of the AHA CEO Roundtable, Aramark is also committed to building a corporate culture of health. Recently, 2/3 of Aramark employees surveyed said they believe their company encourages them to live a healthier life. It is my honor to present Aramark with the Award of Meritorious Achievement. Accepting the award on the company's behalf is Aramark Chief Executive Officer John Zillmer, whose unprecedented leadership places people at the center of everything they do. Congratulations, John, and congratulations, Aramark.
Thank you, Nancy. I want to personally thank you and the American Heart Association on behalf of everyone at Aramark. We are so appreciative of this honor. I'm so proud of the innovative collaboration between the AHA and Aramark and what we've been able to accomplish together. Our work has made a real difference for so many, helping the guests we serve make healthier choices every day, while also supporting our clients, our employees, and the communities where we live and work. I want to share my appreciation for both of our teams and the way they've been working hand in hand over the past 5 years. I really see this award as a recognition of the power of partnership and how we're stronger working together to achieve a shared goal. Through our Healthy for Life initiative, the American Heart Association and Aramark set out to establish an innovative new health impact approach, a whole new way to make a difference. We wanted to leverage the experience of Aramark's many chefs and dietitians and the knowledge and passion of our entire team across the country. We recognized that the best way to make an impact was to work in tandem, Aramark and the American Heart Association, aligning the reach and the resources of both of our organizations in support of a shared goal. There have been so many challenges over this past year, but throughout all the challenges we've faced, Aramark's hospitality culture is stronger than ever, and supporting the health and well-being of all those we serve is as important as ever, probably even more so today. I'm proud that our work has benefited so many, supporting the caregivers and patients in the hospitals we serve, supporting employees everywhere. Supporting employees everywhere they're working, supporting students in K through 12 schools, and supporting those in college and university communities across the country. I'm also proud that Healthy for Life is making such a difference in the communities in which we all live and work, especially now when so many are experiencing such unprecedented challenges and needs. And finally, I'd like to thank everyone at the American Heart Association for your partnership. We look forward to continuing this important work together. And I'd like to say thank you to all of those at Aramark working so hard to make this Healthy for Life initiative a success. Thank you.
Well, congratulations to James, Sandeep, Keith, Denise, Anne-Marie, and Aramark. Well, now I want to check in with you guys. How are y'all doing? We're going to do a quick one-word check-in. I do this a lot with my yoga students. Just how are you feeling? Maybe type in the chat box one word or perhaps a phrase that really captures the impact that these awardees are making. I know that a lot of you have already been doing that, but feel free to kind of circle back, especially now after hearing from all of these awardees. Just let us know how you're feeling while you're watching and hearing, listening and learning. Also, I want to remind you, because we do have social media as well. So if you are up on the Twitter, the Facebook, the Instagram, whatever you use, we have a big social media wall here. And I see that a bunch of folks are sharing photos, they're sharing their congratulations as well. Remember to use that hashtag awards with heart, because we definitely want to let it be known what these awardees are doing out in the world, right? And how much you value their impact. So coming back to what you guys are saying on YouTube, oh my gosh, a lot of proud and a lot of inspired. And I like this. Radhika's got inspired in all caps. Definitely. So grateful, that's another really good one. Fantastic, grateful, proud, inspired, thankful, at ready. I like this from the American Heart Association Hawaii division. Ready for more. There is so much more work to be done. So thank you all for your comments. Oh, I like this one too. Jennifer saying impressed. I too am quite impressed. Let's see if we got anything coming in from the social media side of things. We've got acknowledgement from the Temple Government Affairs. We've got the American Heart Association, of course, itself tweeting Rush University System, shouting out to Lynn Braun, of course. So yeah, if you know someone who's received an award tonight or is just doing a really great job, give them a little shout out on social media. I'm sure they would appreciate it. All right, and keep these comments coming. In the meantime, I invite you to stand up, maybe stretch as you watch how the American Heart Association is empowering millions to live fierce and take charge of their health.
My world, our world, may keep changing, but I'm not going to let the days blur together anymore. This is my awakening, my call to bounce back, to thrive. I stand for those who make up the fabric of my life, where I come from and where I'm going. I stand for my community and for myself. My mission is to change the word challenge to opportunity. And my goal is to live without limitations. Let's make a declaration together. Our future has no boundaries, no limits, no ceilings. I'm opting in, signing up, and using my voice. Today is the day I recommit to my shine, to digging deep for inspiration, to reaching out when I need help and when I can give it, to ensure that all of our voices are heard and the person behind each voice is served, for myself, for my community, for our health, and for so much more, because my promise is to live fierce every day. There is strength in possibility, strength in numbers, and new opportunities are going to keep on coming. With the American Heart Association by my side, I'm ready for them, because we live fierce.
Welcome back to the virtual stage, AHA CEO Nancy Braun, who will present the Earl B. Beagle Award for Staff Excellence to John Miners.
Good evening again. Volunteers bring vitality to the American Heart Association mission, and together with incredible staff leaders, accelerate our impact on health and well-being worldwide. Which brings me to our next award. The Earl B. Beagle Award is the association's highest staff honor, and tonight I couldn't be more proud to celebrate a leader who for 31 years has taken our organization to new heights in revenue generation, international collaboration, and powerful partnerships. John Miners, Chief of Mission Aligned Businesses and Healthcare Solutions. John's talent for engaging staff, volunteers, and community leaders was evident from his early days as Development Director in St. Petersburg, Florida, and soon after as Metro Director in Tampa. Breaking records across numerous benchmarks, John soon set his sights on opportunities for national impact, first as a National Heart Walk consultant, and then as affiliate management consultant, where he worked side by side with the CEO and the board of directors to help modernize the American Heart Association's governance and usher in a new era of growth and efficiency. As executive vice president of the former Ohio Valley and then Great Rivers affiliates, John was the right person at the right time to engage others in a shared vision. His many successes brought him to the National Center, where he initially served as EVP of our emergency cardiovascular care programs, and then also side by side with our international committee when he assumed responsibility for our global strategies, where he expanded our footprint and our global presence in science, professional education, and advocacy to more than 100 countries. This expansion, combined with product innovations like hands-only CPR and resuscitation quality improvement, enabled the association to realize new horizons, today training 24 million people per year globally. As Chief of Mission Aligned Businesses, John's leadership has powered unprecedented revenue growth that has been nothing short of extraordinary. John has grown our mission aligned businesses from $50 million to $179 million annually in under a decade. This past year, in response to the COVID-19 pandemic, John and his amazing team moved quickly to provide just-in-time training and guidelines for frontline healthcare professionals. They fast-tracked interim CPR guidelines and helped launch the first cardiovascular-focused COVID-19 data registry that we heard about earlier this evening. Inventive, resourceful, compassionate, and collaborative, all qualities that can be found in John. His commitment to guide the next generation of association leaders is simply part of who John is. John, in recognition of your powerful legacy and your contributions to mission impact over 3 decades, it is such an honor for me to be the first to congratulate you as this year's recipient of the Earl B. Beagle Award for Staff Excellence.
Well, thank you so much, Nancy. This is such a great honor. Thank you so much, Nancy. This is such a great honor, and I'd like to accept on behalf of all those who rose to the challenge of COVID-19 over the last 18 months. They did whatever it took to overcome adversity and find new ways of getting things done to advance our mission. Those of us that have been around for a while know AHA is at its best when we're challenged and things are difficult. I'd like to use my brief time to recognize a few of the many people that have been instrumental in the development of our mission-aligned businesses. First, thank you to our talented business leaders, Tammy Gregory, Michelle Bowles, Michael Hulley, Patrick Wade, Clive Patrickson, and Brian Eigel for their extraordinary accomplishments over the last few years, building highly profitable and resilient businesses. A special call out to Clive, who is the co-conspirator and co-creator of what we now call Resuscitation Quality Improvement, or RQI. I'm thankful to Tor, Alf Christian, John, and the entire team at Laerdal for our amazing strategic partnership that continues to save more lives every year around the world. Thank you to our heroes in India, including Laerdal Bangalore, Heart Bangalore, and Impulsus teams, who are still battling COVID-19 while continuing to support our vast digital infrastructure. While not the first time, I'd like to again thank Nancy and Susie for convincing me to leave my role as affiliate EVP 11 years ago and move back to Dallas to lead our emergency care program. They thought it might have more potential and diversify AHA's revenue. Well, they were right. And so many more to thank as I run out of time. I have an amazing support team. Any of you that have come in contact with Jennifer Bowman, Sue Simon, Tracy Berto know what I'm talking about. And most importantly, I'm blessed to have an amazing support system at home. Carolyn came into my life 23 years ago, and every year I would tell her, don't worry, I'll travel less next year. Well, darling, I finally made good on that promise, and there's no one I'd rather be sheltered in place with. Thank you again for this recognition. We were made for this moment, and I think now we're just getting started. Thank you again.
Next up, Barbara Fletcher will present Sandra Dunbar as our Healthcare Volunteer of the Year.
It is my great privilege to introduce Dr. Sandra B. Dunbar as the AHA Healthcare Volunteer of the Year. I am Barbara Fletcher in the School of Nursing at the University of North Florida, and Sandy and I have known each other personally and professionally since she joined the Emory University faculty in 1988. As a healthcare volunteer with over 40 years of exceptional service to the American Heart Association and to the field of cardiovascular nursing, Sandy's research has focused on heart failure patients with internal cardioverter defibrillators and their caregivers. She is known for putting the patient and their support system at the center of care to improve quality of life. She has helped heart failure patients with diabetes and their caregivers develop self-management strategies leading to better patient outcomes and dollars saved. During her sabbatical as a visiting scientist at CDC in the early 2000s, she became fascinated with how physical and psychological symptoms in heart failure patients differ in gender and minorities, thus leading to informing many scientific statements on this topic. When she was Associate Dean at Emory, her School of Nursing received the highest NIH funding in the country. There is no one more deserving of this award, and it is my distinct pleasure to introduce my long-term friend and colleague, Dr. Sandra Dunbar, as the AHA Healthcare Volunteer of the Year.
Hello, everyone, and it's a joy to be here with you tonight and receiving the American Heart Association's Healthcare Volunteer of the Year award has been very, very humbling to me because there are volunteers all over this nation leading heart walks, raising funds, and doing other scientific activities. And so I thank the Council of Cardiovascular and Stroke Nursing for nominating me, and to the board and the selection committee for selecting me and recognizing organizational leadership and patient-focused research. It's even more meaningful to me because the American Heart Association awarded me my very first research grant in 1983 as a new doctoral graduate. And even though that $1,000 would be considered very modest these days, it led to a successful research trajectory and was a game changer Later, grant and aids from the Florida and Georgia affiliates helped fund studies of patient responses to serious cardiac illnesses and family-focused interventions to improve outcomes for patients and families. So stating I am grateful for that launch from AHA hardly captures the impact it has had. Thank you, Barbara Fletcher, for your kind introduction and for your initial invitation to get involved in the American Heart Association. As the chair of the Council of Cardiovascular and Stroke Nursing, I learned new leadership skills. I interacted with brilliant nurse scientists and interdisciplinary scholars and the fantastic American Heart Association staff. These relationships have turned into special, enduring friendships over time and over the years. There's no question that the more you give to the American Heart Association in terms of your time and talent and dollars, the more you reap in return. A very special thank you to my family, to my husband, David, and my daughter, Lindsay, who endured many times when I was away, and also to the Emory University School of Nursing for their support of these activities, and to the many patients and families who participated in our research. Thank you so much for honoring me this way tonight.
The Ron Haddock International Impact Award goes to Dr. Bruce Obiagele, presented by Dr. Mitch Elkin.
Hi, I'm Mitch Elkin, and I have the great honor of recognizing Dr. Bruce Obiagele for his work in preventing stroke worldwide. Bruce's path to becoming an international stroke neurologist, epidemiologist, and global health scholar began as a child living in Nigeria. There, he witnessed the effects of tribalism, medical care inequities, and the stigma of brain health-related conditions. From a young age, he vowed to become part of the solution. After finishing medical school in the US, he planned to return to Africa, but he took a detour when he landed a job at a Los Angeles County hospital that served predominantly poor Latinos, where he realized there are under-resourced communities everywhere. To say Bruce has made good on his promise to make a difference is an understatement. He oversees multiple training and research programs, including the largest NIH-funded stroke study in sub-Saharan Africa. He's considered a leader of the stroke community, having chaired the International Stroke Conference as well. In addition to partnering with researchers and educators in Nigeria and Ghana, Bruce practices at the UC San Francisco and San Francisco VA healthcare system, conducting stroke research, translating science into community care best practices, and tackling health disparities. For his tremendous efforts to prevent stroke in Africa, join me in congratulating Dr. Bruce Obiagele as this year's recipient of the Ron Haddock International Impact Award.
Thanks for that very generous introduction, Mitch. Good evening. I humbly accept this very meaningful award on behalf of my collaborators in Nigeria, in Ghana, Argentina, Taiwan, South Korea, and the US. This commendation from the AHA, an organization aligned with our own desire to end disabilities and death from stroke worldwide, will serve as a motivator for us to do more and to do better. Why do we need to do better? Well, unlike in wealthy countries where stroke rates have dropped about 25% over the past 2 decades, stroke rates are actually rising in low-income countries, and no region more so than in Africa. Our work in Africa has identified the major clinical and lifestyle risk factors for stroke, tested several stroke prevention therapies, and we just completed the first ever stroke genome-wide association study among indigenous Africans. Even more gratifying than the science has been the development of capable stroke scientists in Africa. Some of these team members have won prestigious global research prizes and received competitive NIH stroke research grants. Our team's vision is of an Africa eliminating the burdens of cardiovascular disease and stroke through scientific solutions created and led by indigenous African scientists who also contribute to the global body of science. I have a lot of people to thank. First, my gratitude to the AHA, which has supported my career from the beginning and provided many opportunities for me to grow and thrive professionally. As an AHA volunteer, I've been privileged to serve as a local and regional board member, a grant reviewer, a writing committee member, a writing group chair, a council committee chair, a scientific conference chair, a journal associate editor, a campaign ambassador, and a media spokesperson. Second, to my colleagues at the San Francisco VA and UCSF for the privilege of working with and for them, as well as learning greatly from them. Third, to my parents, Bruce Sr. and Helen, who are watching this way past midnight from Nigeria, for instilling transcontinental values in my siblings and I, an appreciation of education, and a strong desire to make a difference. Fourth, to my kids, Chloe, Ethan, and Iris, for their love, their cheerleading, and for keeping me grounded. And finally, to my much better half, Jessica, for her unwavering support over the years and her profound patience with me, ranging from my uncanny ability during sleep to always hear my pager, but seemingly never to hear our newborn kids wailing through the night, although she unfortunately always heard both. To the many extended work hours and incessant trouble, many thanks, hon. Again, thank you all so much for this immense privilege and for your kind audience.
Now, Dr. Jennifer Mirez will present Dr. Stacy Rosen as Physician of the Year.
This year, it is my distinct pleasure to present the award to my longtime friend and colleague, Dr. Stacy Rosen. Over 25 years ago, Stacy joined me at North Shore University Hospital as the second female faculty member in the Department of Cardiology, and we quickly became fast friends, sharing our passion to address the sex and gender disparities in cardiovascular health. And for the past 15 years, Stacy has provided steadfast leadership at local, regional, and national levels for the American Heart Association. We became champions and ambassadors of the American Heart Association's Go Red for Women movement. We continued our work to leverage the power of storytelling with an adventure into Hollywood, where we joined Emmy-nominated producer Trisha Reagan and patient advocate Laurie Russo to produce the award-winning women's health documentary Misdiagnosed, which premiered in March 2020 at the Cinequest Film Festival. As president of the American Heart Association Eastern States Board of Directors, Dr. Rosen worked tirelessly to provide expert guidance, leadership, and counsel throughout the COVID-19 pandemic. She managed to do all of this as a model mother of 3 successful children. As the incomparable Maya Angelou said, "We are here because somebody loved us, somebody sacrificed for us, somebody paid for us. We must never forget that we stand on the shoulders of those who have paved a path for us, and we must acknowledge our gratitude and pay it forward." Tonight, the American Heart Association is acknowledging Dr. Rosen for her instrumental leadership in conquering the challenges of 2020, being a tireless advocate for addressing the disparities in women's cardiovascular health, and advancing the mission of the American Heart Association, inspired by her patients and supported by our amazing team at the Katz Institute for Women's Health at Northwell. Dr. Rosen is paying it forward. A master clinical cardiologist, Dr. Rosen is most deserving of the prestigious AHA Physician of the Year award. Congratulations, my friend.
Thank you, Jennifer, for that extraordinarily kind introduction. I wish each of you could be as lucky as I am to have someone like Dr. Jennifer Mirez as a best friend. She is my bestie. We have had endless, exciting adventures over 25 years. She is a relentless force. I wear a pin on my white coat, right next to my red dress, of course, in the shape of a vaccine syringe, which says trust science. This past year plus has shown us the importance of the American Heart Association's guiding values, particularly bringing science to life and making an extraordinary impact. I've been honored to be involved with the AHA since my fellowship days at the New York Hospital, when in 1989, Dr. Valentine Fuster at Mount Sinai started the New York Cardiology Fellows Society. Susan Somerville, along with Jen and Dr. Stanley Katz, introduced me to the Long Island American Heart Association, with which I have been proudly affiliated for many, many years. Over the decades, I have admired and marveled at the evolution of the AHA's mission, focus, and priorities. The original focus, preventing death, soon evolved to a focus on building healthier lives. I found that inspiring. But my evolution continued as well. I was raised by parents who were educators in two of the poorest school districts in New York City. Long before we spoke about the social determinants of health or the fact that a zip code is more critical than a genetic code, I learned the importance of fairness, equity, and social responsibility from watching them. I have practiced cardiology for almost 30 years and still find myself humbled and grateful for the experience of being alone in an exam room with a patient. We share stories, we learn about each other's families, our dreams, we celebrate good outcomes, and we have shared mourning the less good outcomes over years together. Everything else I do, teach, advocate, strategize, mentor, aims to improve the experience of what goes on in that exam room. Yet the most meaningful evolution of the AHA for me is the one that began with a focus on health outcomes disparities, sex and gender equity, LGBTQ healthcare, maternal health, structural racism, and so much more. Our 2024 impact goal, the irrefutable right that everyone deserves the opportunity to live a full and healthy life, still makes my heart skip a beat. And I get verklempt every year when I attend the Heart Savers dinner on Long Island, and we learn of the lives that are saved through our collective efforts, the families kept together, the communities that are kept whole. As Dr. Fuster said just a few weeks ago when he was honored at the New York City Gala, the American Heart Association is iconic. The friends I've made through my volunteer work have filled my life with joy and meaning. I want to thank other colleagues at Northwell Health, Dr. Jeffrey Cooven, our cardiology department chairman, Dr. Lawrence Smith, the founding dean of the Zucker School of Medicine, Michael Dowling and Mark Salazzo, our CEO and COO. Thanks to my colleagues, along with Jennifer at the Katz Institute for Women's Health, and to Iris and Saul Katz for sharing my passion for eliminating health disparities, sex and gender. My deepest thanks to the remarkable American Heart Association staff. It has been a joy working with Nicole Sapio and the entire Eastern Region team. I am in awe of where Nancy Braun and the brilliant team at National have taken this amazing organization. Congratulations to all who have received well-deserved awards this evening. Finally, I'd like to acknowledge and thank my wonderful family for their loving support. First, my mom, who balanced a career, raising a family, and an enviable marriage to my late father, has always been my role model and guiding inspiration. To my extraordinary children, Rebecca, Max, and Sarah, thank you for tolerating a mom who wasn't home as much as you'd like when you were growing up, who still can't prepare a family meal, and all too often inscripted you for Heart Walks and Red Dress Awards. I am beyond proud of the adults you have become. And to Mark Silverman, my husband, travel buddy, best friend, and the smartest, funniest, kindest human I know, thank you for everything. It has been an adventure. And a quick special thank you to my sister-in-law, Dr. Marcia Epstein, who arranged for me and Mark to be paired as an intern and resident team in the Montefiore CCU in 1985 with the late Dr. Hiltrud Mueller and Dr. James Scheuer as our attendings. Mark did not become a cardiologist, but the rest, as they say, is history. In closing, I want to express my most heartfelt appreciation to the AHA for this extraordinary honor. I am truly grateful for the opportunities and experiences the American Heart Association has afforded me, and I look forward to the challenges and accomplishments that we will share in the years to come. Thank you.
New this year, the Voice of the Mission Award goes to the Blumenthal family, presented by TikTok star and heart disease thriver, JT Laybourne.
Hello, my name is JT Laybourne, a congenital heart defect survivor, and I'm extremely excited to honor a very special family today. The American Heart Association Voice of Mission Award is rightfully going to Kelly, Michael, Mason, and Finn. Finn, who is a fellow heart warrior and congenital heart defect survivor, he and I are kindred spirits because not only did I find out his name actually means warrior, but he shares the same name as my hero, my late grandfather. Finn's family, his mom Kelly, his dad Michael, and his awesome big brother Mason have truly rallied behind not only Finn, but the American Heart Association, helping raise funds and awareness for fellow heart warriors all over. Kelly was already familiar with the American Heart Association through her grandmother's philanthropy efforts for the organization. So when she learned of Finn's heart condition, the entire family didn't hesitate to jump into action. Today, Finn is the national ambassador for the American Heart Association's Kids Heart Challenge and American Heart Challenge. The family has now visited close to 200 schools over the years and speaking at many AHA events. As the pandemic took hold last year and schools shut down, the Blumenthals actively supported the Kick Cabin Fever to the Curb campaign and the reimagined youth market strategies. They've hosted over 50 Zoom calls sharing their story, inspiring families and kids across the country. At just 6 years old, Finn has now endured 18 procedures related to his special heart. So when I say heart warrior, the kid's a heart warrior. So from the bottom of my heart, Kelly, Michael, Mason, and Finn, I can speak for myself and all heart warriors out here. Thank you for what you're doing. Keep up the amazing work. You guys are truly saving lives.
Hi everyone, my name is Kelly and this is my son Finn. He is a heart warrior. This is my husband Michael and this is his big brother Mason. We want to thank you all so much for having us this evening. This is such a huge honor. We were so surprised and shocked and blown away when we heard the news that we received this award. This award is so special to us, not only just because of Finn being a heart warrior and having a couple of open heart surgeries and being a survivor, but also because the American Heart Association has been in our family since the 1960s when my grandmother raised $45,000 for the American Heart Association. Heart disease runs on both Michael's side and my side, and it's just so important that we volunteer and put those hardworking hours towards this amazing cause because the research is going to lead to hope to kids like Finn, families like ours, and people like Michael's dad and grandfather and many, many people to come, and we're just so beyond grateful. I'll turn it over to Michael for a second. I know he definitely wants to say thank you.
Yes, thank you. It's such an honor to receive this award. With heart disease being a part of our family in all different shapes and forms, we're just happy to be able to do our little part to give back to the American Heart Association, and we're honored to receive this. Thank you so much.
So thank you all so much again. We are so honored. Mason and Finn, would you like to say something to the American Heart Association?
Thank you, American Heart Association. We love you. Mwah.
Woman Changing the World is another new award, and Cindy Martin is the inaugural recipient. Abby Davis joins us to present.
Hello everyone, my name is Abigail Davis and I had the privilege of being the Youth Advocate of the Year for the American Heart Association. And not only that, but I have worked tirelessly not only in my hometown but also my state and the United States to try and fight tobacco products and vaping. Tonight, I have the privilege of presenting the inaugural Women Changing the World Award to Cindy Martin. Cindy has been a prominent voice about the long-term health effects that vaping and e-cigarettes have on our youth. Youth vaping rates remains at epidemic levels with nearly 1 in 5 high schoolers currently using e-cigarettes. Cindy has worked tirelessly to protect and inspire my generation to reject vaping and live a tobacco-free lifestyle. She challenged students across her district to create peer-to-peer campaigns and anti-vaping viral messages. As someone who has personally testified on legislation to raise the minimum sales age for tobacco products to 21 years old, I know just how important Cindy's work is. For Cindy, the AHA mission is personal. She shares her story of heart disease and stroke in her own family and is also passionate about women's health, serving as a San Diego Go Red for Women chair, inspiring women to make healthy choices. It is my distinct honor to introduce Cindy Martin as the first recipient of the Woman Changing the World Award. Congratulations.
Thank you so much. What an honor to get this beautiful award. I need to show it to you so you can see what this looks like. Is this gorgeous? Women Changing the World Award, and it's just so pretty. So thank you so much. And there are so many women who are doing things to change the world. And I just have to say thank you to the American Heart Association for this incredible honor. And I'm so glad this is a new award because I can't wait to see who gets it next year. There's so many women I'm thinking of right now. Women truly do hard work to change the world. And I'm going to quote my favorite poem by Mary Oliver. And it's a poem. My favorite line is, "I'm a bride married to amazement. And all I do each day is think about how I can wake up and serve." And when I see and I'm inspired by the youth of today and the vaping campaign that we did in San Diego, you can see that our young people truly have a vision and the heart to change the world. And I'm just happy to be a leader. As a lifelong teacher and recently superintendent in San Diego Unified School District, and also chair for Go Red for Women, this is heart work for me. I have to say thank you to the American Heart Association for what it's done to support the youth and the youth market specifically. When I think about the American Heart Association's commitment to heart health, especially for children, and the You're the Cure network, where you see all the youth advocates whose stories and experiences give us the kind of clarity we need about what students go through, that's a real change-making program. And of course, I love the Kids Heart Health Challenge, because American Heart Association teaches our young people that a happy heart is a healthy heart. So we teach them through the Heart Challenge to eat great exercise and drink water and eat healthy, but do one kind thing a day. And imagine when we teach our nation's youth to just do one beautiful thing a day, because a happy heart is a healthy heart. I'm going to give a great big thank you to the San Diego office of the American Heart Association, and specifically Chelsea Clark. When I said I wanted to serve and be Go Red for Women chair in San Diego staff stood alongside me so that I could do that service and teach our children and the bigger community. 16,000 employees in San Diego Unified with our employee wellness campaign. I'm just so grateful for the support that I had in San Diego. I'm dedicating this award tonight to my beloved husband, Sergio, who was a survivor of a heart attack and quintuple bypass surgery at a very young age, and then survived stroke. And the doctors who saved his life twice were doctors that were funded through research through American Heart Association. So a big thank you to Dr. Karen Albright. Her research on stroke and basilar artery stroke in particular, she's a woman who changes the world, and I will nominate her for somebody who can get this award in the future. I dedicate this finally to my mom, Fern Siegel, who is watching in San Diego. I know my mom is proud of me as I'm here accepting this award in Washington, D.C., as I step into a new role serving as President Biden's Deputy Secretary of Education. And I'm grateful for this award, and I look forward to continue to helping change the world alongside an incredible organization like the American Heart Association. The mission could not be more clear. Thank you to everybody.
Wow, such amazing volunteers. And I love that sentiment that a happy heart is a healthy heart. Congratulations to John, Sandra, Bruce, Stacy, the Blumenthal family, and Cindy. Our third Gold Heart Award goes to Alvin Royce, who will be introduced by some very special guests.
I am very honored to be with you this evening to celebrate Al Royce as an outstanding American Heart Association volunteer leader. I am Jennifer O'Sullivan, Al's daughter. This Gold Heart recognition personifies who my dad is, one who leads from his heart for the betterment of others. For those of you who know him, you know he loves a good quote, 3 main points, and a good laugh. Most of the time at a joke he just told. So in true Al Royce fashion, number 1, Al Royce has a servant's heart. His life exemplifies Arthur Ashe's statement: start where you are, use what you have, do what you can. Dad's relationship with the AHA began in 1997 when he chaired the local San Francisco Heart Walk, setting a local record of dollars raised. But he is most proud of rallying a record number of walkers who walked in support of the AHA mission that day. He has an infectious spirit and is unstoppable at inspiring people to join in. It wasn't long until Al became a national volunteer leader, ultimately serving as chairman of the board in 2015. During his tenure as chairman, he worked alongside the board members to develop and implement the strategic plan and strategic value proposition, and many other notable accomplishments worth celebrating. However, serving people is what truly motivates him. Point 2. Al Royce has a heart for community. Building community, impacting community, connecting into community through service. He often speaks of the What's Your Why campaign and how powerful storytelling builds a lasting connection to the mission. Today, Voices for Healthy Kids is a cause where he devotes much of his time. And finally, number 3, Al Royce has a heart of gold. Dad, you generously give your time in support of others. Your life has been an example of what Arthur Ashe said. You do this in the shadows, behind a spreadsheet, behind a podium, or in a stadium, and you empower others to do the same. Your family and loved ones are so very proud of you. I know your why are your boys, Rory and Liam. So,
congratulations, Papa! We love you! You have a heart of gold!
Well, thank you. I'm not sure how to follow that. I'm actually speechless, but I don't want to give you hope. I actually do have a few words to say. But thank you, Jennifer and Rory and Liam. Thank you so much. I am literally blown away by that. Like all of us tonight, I too am honored and humbled and grateful for the privilege of receiving an award, and this award in particular. I'm honored because I know what the AAH stands for. I know what it has done and continues to do, and I know the impact it makes. And I'm humbled because I know many of the recipients of this recognition in prior years and on the stage tonight. And they used to say that you're known by the company you keep. Well, if so, I'm in good company tonight. And I'm grateful because there's so many people so deserving of this type of recognition. And so I accept it on their behalf because I know I'm here as a visible sign of them. So thank you, AHA. Thank you so much. There's just too many people to thank, and time doesn't permit it, but no, if I could, I would. But I do want to call out 3 people in particular because they mean so much to this organization. They meant so much, and they've been so close to me during my tenure. One, of course, is Nancy Braun. I don't know if there are words to describe her, but when I think of Nancy, the word that comes to my mind is transformational. She has the ability to see the future of healthcare and the skill set to get us there. And she has been such a mentor to all of us, and particularly including me. So Nancy, thank you so much. And I also want to shout out to the 2 doctors who served as presidents during my term as chairman. The first year was Dr. Mark Krieger, himself a Gold Heart Award recipient last year. And this year, Dr. Stephen Hauser, a Gold Heart Award recipient. Both of these gentlemen are both inspirational and aspirational. And I can't tell you how much they meant to me and how much I've learned from them. I get asked a lot of how did I get involved with the American Heart Association and why? Well, the how was just an act of fate. I was asked, purely by accident, I might add. But I might have been asked, but the reason I stayed, actually the 3 reasons I stayed, thank you, Jennifer. Number 1, I stayed for the mission. We improve and extend people's lives. We save lives. What could be a greater mission? I stayed because of the people. You will never meet a greater group of dedicated and passionate volunteers and staff members than with the American Heart Association. They are making an impact, and I appreciate that. And I stayed for the results. My background is business and accounting and law, and I look at the bottom line a lot. And when you look at the bottom line of the American Heart Association, you cannot help but be super impressed by what they've accomplished, whether it's in women's health, whether it's equitable health, whether it's global adventures, whether it's innovation, precision medicine, one brave idea, the collaboration with others, whether it's advocacy, community building. They get results across the board. You know, my parents grew up and were born in the 20s when the American Heart Association was formed. Since their formation, their life expectancy expanded by 20 plus years during their lifespan. Now, I don't know how much of that was attributable to the American Heart Association, but I'm willing to bet an awful lot was due to the research, their improvements in care and prevention. And I'm so grateful for that. But my real bottom line is right here. And you just saw him just a minute ago. Whoops, wrong picture here. There we are. My two grandsons, Rory and Liam. And if you're a parent, a grandparent, or have nieces and nephews, you understand what I'm talking about. Our goal is to eradicate death or disability from CVD and stroke. And the reason we do that is for people like this, for our grandkids, our nieces and nephews. They're my why, and they're why I did what I did. I want to thank the American Heart Association for having given me the opportunity to have been a volunteer and served on their board. I want to thank the American Heart Association for allowing me to meet the best people in the world, doing the best work in the world. And I want to thank the American Heart Association for helping me help them make a difference. I only have one quote. It's for one of my predecessors, Bernie Dennis. And I loved his quote. Thank you for this award. It's way wicked awesome. So thank you.
Al, congratulations, and thank you for sharing those darling little ones with us. Our final Gold Heart Award of the evening goes to Dr. Stephen Hauser, who will be presented by Dr. Wally Koch.
Hello, everyone. I'm Wally Koch, and it's my honor tonight to introduce Dr. Stephen Hauser. Steve and I have been friends, colleagues, and collaborators in the last decade together here at Temple University, where we both study novel mechanisms of heart failure. In fact, Steve was the first person to get me engaged in the American Heart Association, encouraging me to join the leadership committee of the Basic Cardiovascular Sciences Council. That's one of the great things about Steve, and I think now 2 to 3 generations of young scientists have benefited from his sponsorship. Over the last 2+ decades, he's chaired the National Research Committee, and of course in 2016 and 2017, he led the organization as president. Under his leadership and guidance, several initiatives were developed, including the strategic value proposition. Steve was involved in sharpening the focus of health equity, which we know is so important to patients. And he was involved in launching One Brave Idea, which has culminated in the Innovation Center in Boston, which is revolutionizing coronary heart disease detection, again, benefiting a many number of patients who suffer from this disease. Other initiatives that Steve was involved with include the Paul G. Allen Foundation initiative and partnership with the American Heart Association to increase our initiatives in brain health and cognitive impairment, which again will be able to help more and more patients who suffer from these diseases. Steve was also involved in setting up new clinical outreach programs in China and the Middle East. Dr. Stephen Hauser is eminently deserving of the American Heart Association's highest volunteer award, the Gold Heart Award. Congratulations, Steve.
Thank you, Wally. It was a very kind introduction. It's really a great honor for me to receive this award from the American Heart Association. And I want to take my time to thank some of the people who have helped me be an effective volunteer for the last 40 plus years. I want to start by thanking my family, my daughters, Ellie and Emily, and my wife, Beth. Their love and support have kept me going in good and challenging times. I'd like to thank my lab family, my numerous students, postdocs, and staff who have made discoveries that have advanced our field of science. I'm proud of all of you. It's great fun for me now to watch you as you find your unique paths in science and life. I'd like to thank my Temple Medical School faculty family. Your support has been essential in my career. I'd like to thank my Basic Cardiovascular Science Council family. I grew up in BCVS. You're my friends, my colleagues. Your science will form the basis for the next generation of therapies for people in need. And finally, I'd like to thank my AHA family. Serving with all of you has been my great pleasure and honor. I would like to thank all the previous AHA presidents who have been so kind and helped me in my journey. I also want to thank Al Royce for teaching me about the critical aspects of the organization and for his friendship. I'd like to thank Rosemarie Robinson for forcing me to think beyond basic science and learn about how we can improve everyone's health. And finally, to Nancy Brown for entrusting me with the keys to the organization while guiding me along the way. The most surprising thing I learned during my AHA journey is that to be an effective volunteer, you have to have a total commitment to the guiding values and mission of the organization. I actually have the AHA guiding values saved on my desktop, and I try to look at them every day. They inspire me to be the best person and the best volunteer that I can be. I want to close by saying that everyone honored here tonight has made their own unique contribution to our mission, to be a relentless force for a world of longer, healthier lives. I look forward to continuing our work together, and thank you again for this wonderful award. I'm greatly honored. Thank you.
All right, and to wrap up the event, we're going to present two distinguished National Leadership Awards. Ray Vara, incoming chair of the board, joins us to say a few words about Bert Scott, who has served as AHA's chairman of the board over the past 2 years. Welcome, Ray.
Great. Thank you. What a wonderful evening. And it is my great privilege to present my friend Bert Scott with the Distinguished National Leadership Award. Bert has served as a volunteer leader at every level within the AHA. I've gotten to witness firsthand his leadership over the better part of the last decade as we've served on the national board together. In fact, Bert and I joined the board on the same day, and we went through orientation together, and I've gotten to see all of his work during the course of the decade as he's led this organization in an extremely effective way. Probably even more importantly than what I've witnessed in his leadership at the AHA, I've gotten to experience what many of us as volunteers get to experience. We make great friends and deep relationships through the time that we spend together. And that's certainly true of my experience with Bert. He has become one of my closest friends. So true of that with my wife, Tiffany. And we look forward to every time we get to spend time together. You know, Bert has brought leadership in the levels of his experience from his corporate background to his marketing background, and also through his personal experiences. I know through having conversations with Bert just how deeply he cares about the mission of the organization and how he brings that forth each and every time he has the opportunity. I can say without any doubt that the AHA and the communities in which we serve are stronger today because of Bert's leadership. And it's not lost on me for 1 second how big the shoes are that I'm set forth to fill when I become chairman in a little over a week. And so again, it's with great pleasure that I present Bert Scott, my friend, my colleague, with the Distinguished National Leadership Award. Congratulations, Bert. I couldn't be more proud.
Thank you, Ray, for those incredibly kind words. I also want to share that you have been incredibly helpful to me as I have filled this role for the past 2 years. You've been a good counselor, you've been a great confidant, and of course, a terrific friend. And our relationship has gotten stronger through these last 2 years, which have not been the easiest 2 years in the AHA history, as you know. You will do a terrific job. I have no concerns about you filling those shoes. You will do extremely well. So thank you again. And thank you to the AHA for this special recognition and prestigious award. I, like many others, am humbled and honored to receive this award. My work at the AHA is a labor of love. It is also in tribute to my late father and first wife, both of whom lost their lives in their early 50s to heart disease and to stroke. It is that legacy, their lives, that I attribute all of the things that I do at the American Heart Association every day. It has frankly been my pleasure to lead the AHA during this critical time in our history. We have accomplished a lot in an incredibly challenging environment, and I'm proud of all of the work of our staff and volunteers during this past 2 years to navigate, as I said, a very difficult environment and still accomplish an incredible amount. The list of things we have accomplished is far too long for me to read, but certainly when you go through a pandemic, social unrest, economic disruption, and still serve communities the way we have served them, we can be nothing but proud. I would be remiss if I didn't thank a few people. First, my two partners in crime for the last 2 years, the immediate past president, Bob Harrington, and our current president, Mitch Elkin, both of whom I consider as friends. We've become very close, as many people do in the AHA. They have been incredible partners and outstanding leaders in their own right during this time. Also to the AHA staff, and someone said this well earlier, there's a secret sauce here. It is difficult to bring together a series of volunteers and staff and make that work every day effectively. And I attribute that effectiveness to the staff at the AHA. They understand the importance of volunteers and they make our lives easier. Nancy Brown in particular, you and your leadership team have made my tenure as chair of the American Heart Association very easy. And you've been immensely helpful to me and propped me up many times during this process. And I want to thank you publicly for that. Finally, I want to thank my family. I have 5 children and 5 grandchildren, all of whom are very special to me. And as Al Royce said, I look at that family every day and think of the work that the Heart Association will do and has already done to extend their lives and make their lives better all the way around. And before I close, I want to once again congratulate all the honorees, and I'll probably do that again a little later. But I also want to congratulate Ray and Don Lloyd-Jones as they take over leadership of this very important organization at a very important time. I am proud of both of you. You will do an outstanding job. And thank you for all your support when I was in this leadership role, and good luck. And thank you to the AHA once again for this heavy and outstanding award. Thank you very much.
Bert, congratulations. Also receiving the Distinguished National Leadership Award for his outstanding contribution to AHA as president this past year is Dr. Mitch Elkin. So welcome back, Dr. Donald Lloyd-Jones, incoming AHA president, to say a few words about Dr. Elkin.
Well, Mitch, it's such a pleasure to celebrate you as you complete your year as president by recognizing you with this Distinguished National Leadership Award. I'm sure that all of us recognize that this year's president has been nothing like what you or any of us expected. There's been none of the usual travel or meetings and lots of extra Zoom calls that allowed greater reach across the globe, but certainly less human contact. And yet you have handled it with your characteristic grace and calm always. You've shown incredibly thoughtful and deeply committed leadership to the AHA, and in every venue, you always ask the important and thoughtful question that leads to greater insight and a better way forward. I have been so impressed with your sense of the importance of doing the right thing always. Just for one example, last summer when we were selecting the awardees for the top science prizes to be given at sessions in November, you had the wisdom to select a slate entirely made up of women scientists for the first time in our history. Those awardees were spectacularly accomplished, and yet we had never done that before. But you knew it was the right time and it was the right thing to do. This year, you've led us fearlessly through our responses to the COVID pandemic and to the wider societal syndemic. And we needed your leadership not only for navigating our response to the virus and its health effects, but also as we finally began to understand and confront the issue of structural racism and its horrible impact on cardiovascular health, as well as on susceptibility to COVID in vulnerable populations and especially in communities of color. Throughout all of that, you carefully and thoughtfully shepherded our renewed commitment for social justice and for health equity. And we all know how truly selfless you've been in giving of your time and your knowledge to the American Heart Association. Coming into this year, you were only the second neurologist to lead our organization, so I would be remiss if I didn't mention your tireless advocacy for stroke prevention and care, as well as brain health more generally. For all of these reasons and so many more, I'm honored to present you with the AHA's Distinguished National Leadership Award. Thank you for all you've done and for all you continue to do to make us a better and stronger organization. Mitch, congratulations. So well done and so well deserved.
Wow. Well, thank you, Don. I am so touched. Thank you for that extremely kind introduction. This has been a truly exceptional year for all of us in so many ways, and I'm honored to have had this opportunity to serve as president during this once-in-a-century event. We tackled so many truly important issues that go far beyond my own clinical area of stroke: COVID and its effect on the heart, the economic impact of the pandemic, political upheaval, and of course, structural racism. And this award is a reflection of a team effort, what my family and I call Team Potaha. And I was so fortunate to have a truly stupendous team to back me up. First, Bob Harrington. I'm so proud to count you among my friends. Thank you for teaching me just a fraction of what you know. DLJ, I can't wait to see what you accomplish next year, which, by the way, starts in 1 week. Bert, my dear, dear friend, thank you for introducing me to the AHA and for allowing me to sit by your side. Marielle and Eduardo, your knowledge and insights kept me grounded through many meetings with our international colleagues and volunteers. And of course, I'd be remiss if I didn't acknowledge the incredible support of Ralph Sacco, the first neurologist to serve as AHA president 10 years ago. Ralph has been a mentor and a friend for 25 years since I joined him as a fellow in stroke and epidemiology. The extraordinary staff of the AHA made the year almost easy. I have such fond memories of coming down to AHA headquarters, my first time ever, soon after getting vaccinated, of course, to film my speech for the International Stroke Conference and learn about the history of the AHA. Laura, Debbie, Ray, Angela and Beverly, Rosemary, Jamie, Crystal, Suzanne and the media team, and so many others that I just don't have time to name. It's been a pleasure to work with and get to know you all. And Nancy, thank you for supporting me and trusting me through this incredible year. You know, I spoke in my Connor lecture about building bridges, but some of the most important bridges you have built are among the people in this virtual room. You bring together people from so many different backgrounds and areas of expertise, staff and volunteers, physicians and business people, scientists and marketing experts, all with a common passion for improving the health of others and an uncommon capacity for hard work. For me, this is what makes the AHA so special: the chance to get to know, work with, and become friends with all of you. So I thank you, Nancy, for making this possible, and I thank you all for being here this evening, and I appreciate the honor of this award. And finally, I just want to say how much I appreciate the support of my wife, Rachel, and my boys, Zachary and Liam, who aren't here, all of whom also supported me in ways great and small this year. For them, I am beyond grateful. Thank you again for the honor of this award.
Oh, that's wonderful. And let me again congratulate all of our honorees tonight. It has been just an incredible evening.
You know, I knew AHA had amazing volunteers, but this evening really took the cake.
And let me just add my congratulations to our deserving honorees. Each of you represent an extraordinary commitment to patients, to communities, and to people who relied on the AHA this year and in many years in the past. So many of you put your own health and safety at risk to help heal the sick, protect our most vulnerable, and provide critical support services. Your courage and your resilience are to be commended, and we are so grateful to have you as part of the AHA family. And now, back to you, Sonia.
Thank you to everyone who joined us tonight. Truly, from my heart to yours, I want to extend a very special congratulations to all the awardees who were truly made for this moment. Good night.